Hello, this is Tessa Kegel, and this is HBS5OHC, Chemical and Other Hazardous Substances, Toxicity, Reactivity, Measurement and Management of Chronic and Acute Exposures and Effects on Workers' Health, and this is Part 3 of Module 5. This is the Commonwealth of Australia Copyright Act 1968. Investigation of chemical hazards. There are three primary ways of systematically identifying chemical hazards. First of all, by counting the bodies. Next, by workers notifying their problems to superiors or their doctors. And finally, by clinical observation by doctors and related health professionals. Epidemiological studies involving humans mainly fall into four main groups. Now, just to let you know that we're going to be returning to this in a future module. However, in brief, the four main groups are controlled human exposures, where volunteers agree to be exposed to chemicals for specific time intervals while their body's functions are measured. Next, we have natural human exposures, responses of natural groups of people who've been exposed to chemicals or pollutants. So these opportunities arise after events such as volcanic eruptions, oil spills, or nuclear power plant accidents. Next, we have population-based studies of chronic health, such as the effects of air pollution, for example, measuring lead found in hair. And finally, we have controlled exposures of laboratory animals. Now, these studies help to identify data which can be used to explore the exposure-response relationships relevant to humans and their exposures to various chemicals. Exposure-response relationships can be developed from human experience, but there are many chemicals that are known to be toxic in animals for which the extent of human toxicity, if any, is unknown. So needless to say, understanding the various exposure-response relationships for humans to different chemicals is quite complex, and a number of different modelling approaches need to be applied. Now, it's worth noting that extrapolation of data is most reliable for the conditions which are similar to the experimental conditions and those that produce clear-cut responses. In real life, factors which can influence the effective dose of the toxicant reaching a particular body organ or site include the route of entry, the nature of the contaminant, and individual sensitivities. Health effects, the body's reaction to toxic substances. The body may deal with toxic substances in one of three ways: either excretion, storage, or through a metabolic reaction. With excretion, removal may be from the lungs via coughing, sneezing, or lacrimating. Toxic substances may stimulate vomiting, which will remove them from the stomach. Many chemicals pass into the bloodstream and are removed by the kidneys, which may result in kidney damage. For storage, some substances, such as DDT, are stored in body fat or tissue, having a constant exchange with the bloodstream, resulting in damage. In terms of metabolic reaction, toxic substances may be detoxified by the liver. This may be accompanied by liver damage, such as hepatitis or cirrhosis, and also the production of reaction products which are more toxic than the original. Risk management for chemical exposures. The fundamental concepts of risk management apply for the management of chemical exposures in the workplace. First of all, risk identification, then risk assessment, and finally, risk control. The identification and assessment of chemical risks has been discussed in previous modules, including the quantification of hazardous exposures using exposure standards and safety data sheets and other prescriptive tools. Edwards and Benke, in a very useful Australian occupational health and toxicology and epidemiology textbook, address some of the complexities of exposure assessment and the establishment of ill health causal relationships. These include the need to identify or measure each and all stressing agents in isolation, to collect information about body responses to every presenting hazard in a work situation. For clear information about the relationship between the existing hazards and the worker's actual level of exposures. For clear information about interactions between multiple hazards and their harmful effects. To understand potential doses and responses and the strength of potential causal relationships. And to assess the multiple causes of disease, including factors external to workplace hazards. And finally, risk management for chemical exposures needs to establish a history which considers and includes time factors, damage factors, and dose factors for specified chemicals. The OHS practitioner needs good hygiene knowledge of hazardous agents in the workplace, the level of exposure which constitutes a risk, how to implement and manage procedures to monitor the workplace and control workers' exposures. So, this module has discussed the effects of selected chemicals on health. It's introduced different classifications of chemical hazards and briefly discussed how health hazards have been determined. And having worked through all the readings and activities, you should be able to identify when you need to use expert hygienist assistance and how to integrate their advice into a safe system of work, all based on accurate information relating to control of exposures of chemicals to workers.